started here in a minute. Yeah, and folks can feel free to turn on your video or not. It's up to you. You know, we wanted this to be kind of like as if we were in person, even though we can't be interactive. But I got to tell you guys, almost 200 people signed up for this. Like, that is insane. I literally expected like 25 people maybe. And so this just shows that there's so much amazing energy and excitement and, you know, just awesome people out there doing great work. I am so pumped. All right, let's see. I think we're still getting some folks trickling in. Oh, great. So I see folks messaging in the chat. Feel free to put your name in the chat and introduce yourself. You know, let folks know where you're zooming in from, and if you're, you know, work with an organization, what is that, what you're up to. This is great. All right, let's see that we're still letting folks in. All right, so maybe we'll go ahead and just start to kick it off. I'm like literally, I'm so blown away. It's awesome. Hey, Kim. And I see Brandon. We've got some of our Recovery Policy Collaborative folks. I see some folks who are in the Masters in Addiction Policy at Georgetown. Benjamin, what's up? Oh, this is so awesome. And yeah, I see people doing intros. So let's just get started. So my name is Shelley Wiseman. I work at Georgetown University at the O'Neill Institute, which is, it's like a health policy think tank at the Law Center. And we do a lot of different projects that focus on global health and domestic health care. So we have like an HIV project, several of them. We have projects that focus on food safety, on reproductive health. And I work on a project that focuses on addiction policy. And I've been at Georgetown about 3 years. And before that, I was working in the governor's office in New York, doing addiction and mental health policy and operations there. And so I'm a person in long-term recovery. Today is actually my celebrating 24 years in recovery today. I was like, there's nothing else that I would rather be freaking doing on this day than like doing something like this, because this is the energy. Like, this is where I get super pumped and excited and grateful, and, you know, like just trying to live a useful and free life, you guys. And this is where it's at. And so I was working in the governor's office, and I met a guy named Tom Coder, who I think probably many of you know. He was recently the acting director at SAMHSA. Now he's the deputy. He couldn't join today, but he's involved in this project. And he was the first person also in recovery that I met that was doing the same kind of like work, policy work. I had never met anybody before who was working in government and impacting policy. He was working for the governor of Rhode Island at the time, and I was working for the governor of New York. And it was just completely inspirational to see, all right, like there are others of us. And then over time, I started meeting more and more and more people who were working in the public policy space out of, you know, wherever expertise they had. but also had lived experience with addiction. And people's stories were incredible and just incredibly inspirational. And, a group of us got together and we thought, what if we just all like started meeting with each other and connecting? And so we started doing that like right after COVID. And we formed this collaborative. We call it the Recovery Policy Collaborative. And I see a bunch of folks that are part of the collaborative here today. Chris Jones, what's up, Kim and Brandon, George, and I can't even see everybody because there's so many people in this session. It's amazing. And, we just started meeting. And one of the things we were incredibly amped up about is how do we get more people who are engaged in this kind of work to come together and be at the table that decisions are being made, table with a capital T. And we're not talking about, people coming in and like telling their story and then everybody claps and then the real experts make decisions, quote unquote, right? We're talking about people who can have a meaningful engagement and impact in public policy day in and day out. And one of the things we wanted to do was develop this fellowship. So that's kind of how we got to where we are today. So this would be several folks. I don't think we've decided how many. In my mind, it was a few people, but now seeing how many folks are in this room, we might have to shift. We'll see. But and bring them on board for a year. Have a mentorship component, have a educational component, and I have a PowerPoint that I'll go through in a minute, but and really just start to build a bench of leaders and emerging leaders and people who are doing this work out there to impact public policy. So what I'm going to do is share my screen, go through the PowerPoint, hopefully quickly, just what is it that we're doing. And then it'd be great to kind of hear questions, hear from you guys, and see what we can kind of do and build here. All right. So the vision, right? And I start with this number because it really hit me, I think, a couple of weeks ago when this number came out. Over 100,000 people lost to overdose in the last year. And what isn't reported routinely, I think, is, that there are many millions of us out there who are thriving in recovery and who have experienced addiction, who have been at the lowest low. And now, we are living this incredible, beautiful and useful and purposeful life. And so the vision, an empowered network of diverse and informed people at decision-making tables in and out of government who are armed with the tools, expertise, and connections to revolutionize our systems and impact policy through the lens of lived experience, right? Because time is now. The time is now to make a shift. And the vision also includes a space where we can support each other, where we can kick ideas around and grow something and learn from each other and others out there. Okay. So I talked a little bit about the Addiction and Public Policy Initiative at O'Neill. So I'll say this fellowship is going to live at the O'Neill Institute, but it's being done in conjunction with a network of folks who, like I said, are working in and out of government, who are in recovery, who have lived experience with addiction, which is the Recovery Policy Collaborative. That's what we're calling it. And these are people who are, in all different kinds of roles and positions, and who have just a wealth of expertise. And, everybody's on our website, but you can see some people here. And so the goal, more of us out there who are doing this work. So what are we looking for? People who are already leaders in their communities, whether it's in their organization, in their state, or at the national level, a range of diverse backgrounds, and lived experience with addiction. And when I say recovery, I'm talking about all pathways to recovery. So it could be 12-step recovery, which was my path. It can be many other pathways. We embrace all definitions. And, also what we're looking for is people who are in communities that are not traditionally represented at the policymaking tables. And I also put no minimum degree requirements. People can have degrees, can have master's degrees, PhDs, or law degrees, or whatever, but also people who, haven't had that educational pathway are welcome. So what is it? What are we going to be doing? This is a 1-year virtual or remote opportunity starting in February 2022. Now, this isn't going to be like a full-time job. This is where people are out there working in your community or whatever it is that you're already doing. And this is to supplement that work, supplement your professional and personal development. And so what you would be doing is developing a policy project over the course of the fellowship of your choosing that can be developed with folks who are involved in the fellowship program. You'll have the Georgetown platform to publish content, to host meetings, to do different things, which, I found, being at Georgetown the last few years has really helped to elevate and amplify my work. So that's something we want to definitely utilize. You'll be connected with a mentor, somebody who's a member of the Recovery Policy Collaborative to work one-on-one with, and also a full-on network of experts in the addiction policy field. We'll have a policy academy in Washington, D.C. Not totally sure yet exactly what that's going to be, but it'll be a couple of days in Washington, D.C., where we bring in folks to talk about the fundamentals and basics of policy making. So like a policy making 101. And I know for me, I had been kind of working in programs, and then I went to law school and was working in the system, but there was a lot that I didn't know, I didn't know about how to impact and influence the system. And so I think that, this is an opportunity to fill some gaps for folks. And then it'll also involve collaboration with experts here at the O'Neill Institute, at Georgetown writ large, and folks that are part of the policy collaborative. And we're going to be doing a small stipend, and travel to the kind of kickoff in DC. But it's, again, it's not like a full-time paid employment opportunity. It's a supplement opportunity. So again, the kickoff, we're looking at mid-September, after Labor Day. And we want to do a lot of other kind of ongoing networking opportunities and educational opportunities. So how to apply. And this stuff is on our website, and we can put the link in the chat too. But so send over an application package with your resume and project proposal. And what we mean by project proposal is we want people to think about what is it that you would want to accomplish. What's your big idea of system change, and include, a little bit of meat on the bones about what that is, a description of, summarizing what you want to do, and what's the problem you're trying to solve, who are people that you think you might need to work with, and what are some of the potential things to accomplish it, what would you develop over time, and when, and, would you be seeking funding for it? It doesn't have to be, we'll say like 100% baked, because that's kind of the point of the fellowship. And even if your project might change over the course of the year or become different. But I think what we want to see is, some thoughts and ideas already kind of started percolating. And then a brief description of you, how did you get to where you are? Why do you want to do this program? And then 2 letters of recommendation from folks that you've worked with. December 31st, that's our deadline. And then we will be have a selection committee that will review everything and notify folks by April 1, and then the program begins in September. So just a couple of other things. So this is one opportunity that we have cooking at Georgetown, but our thought is we want to do a continuum of capacity building and bring folks in, to different opportunities. So one that I'll mention, especially because the applications are open now and there's an info session about that this week as well, is a Master of Science in Addiction Policy and Practice, also here at Georgetown, the Graduate School of Arts and Sciences. And this is a 1-year interdisciplinary master's program. You graduate with a Master of Science. Regina LaBelle, who was just recently the acting director of the Office of National Drug Control Policy and also works with us at O'Neill, is the program director. It's a wonderful, it's just a wonderful opportunity. 1-year master's degree, bam, like get it done and get out there and do the work. And so December 9th is the info session for that. So maybe Summer or Shema, you guys can put the link in the chat. So if people want to come to that too and see, maybe that's for you. We also have other opportunities at O'Neill for people who have just graduated from law school, as well as, okay, so this is the fellowship. So this is for new law graduates, people who went to law school, graduated, and then want to do something like this in their first year. So here's the information about that. And then at the Addiction and Public Policy Initiative, we have internships for law students, graduate students, and medical students as well. Full-time summer internships. And then during the year, I've had folks reach out who are in grad school and want to do an independent study with us, and we make that happen. So there's definitely, other opportunities if you're currently a student. So I'll stop sharing. So that's what it is. And, before we kind of jump into questions, I wanted to give an opportunity to the policy collaborative members that are here, if you wanted to say anything about yourself and what this could mean. So, Brandon, Kim, Chris, Patrick, anyone, if you want to jump in, feel free, and then we'll open it up to questions.
Hey, everybody. I'm really amazed at the turnout of folks on here along with Shelly. It's just really warms my heart to see so many people caring about this topic. I think one of the main reasons and benefits, you can see it from community that's on here right now, is that when people get into leadership positions around in their communities or in their states, et cetera, the group of people and peers that you have that are in similar spaces shrink significantly. And I know that when Shelly originally started bringing the recovery policy collaborative together, before it had a name, that was one of the major benefits, was to have a group of people who worked in similar spaces to support one another. And so, and then to start incubating ideas that she has mentioned. So I think it's a really, really great opportunity for folks that are interested in policy. There's an amazing group of academic leaders, government leaders, nonprofit leaders that are involved in this. And I know me personally, from having been involved with the group, I've learned so much by just having access to these people. It's not every day that you have access to other people who have shared lived experience with you in these types of positions. And so think it's an amazing opportunity. I'm really, the turnout's amazing. And so I'm grateful everybody's on here, and look forward to a bunch of great applications for this fellowship.
Yeah, this is Chris. I'll say ditto to what has been shared. It's really exciting to see from what was sort of an idea of bringing people together to really trying to formalize something that has legs and can be sustained and make positive impact. And I, my sense of being a person in long-term recovery, also working in the federal government for a variety of agencies within HHS, is that it is a small world. And we are often, oh, do you know this person in this state? We want information from here or there. And so I think this is a real opportunity just to continue to build the network. And I would say that, from our perspective, we're certainly interested in policy at a federal level, but oftentimes we want to raise up those successes at more local levels. And so a fellowship like this can also be that opportunity to help raise awareness of things that we need to be aware of at the federal level that we're not aware of, that could be scaled up. We need better solutions, more innovative solutions. We need to leverage how people are responding to a really tough environment on the ground to help people, to reduce harm, to reduce overdose, to help people achieve recovery. And so I think it's an opportunity at all levels to really think about how to raise those issues up. So glad to be a part of it.
Hi, it's Stephanie. Really wanted to ditto what my colleagues are saying. And I think too, we've been saying for a long time in recovery, we've been advocating for research. And I do believe that this gives us an additional way to really create legitimacy and expertise, not only for our own community and for the folks in government, but for other healthcare sectors. I think that we talk a lot about integrated care, and yet there hasn't been the level of research and information that's provided across all of the public health sectors about our condition. And so I think this collaboration is a real opportunity to not only continue the conversation internally with us and our relatively small community, but really educate the larger community and empower us to continue to do that.
Hey,
Donald, you're up.
Donald McDonald. Hey, I know how much I benefited from what was actually an ad hoc network of folks to support my desire to discover my passion and make some change, and not even seeking leadership, but seeing leadership potential within me. And this is such a deliberate way to make that available to folks. And what I really love about this is your access to folks at the O'Neill Institute and the Recovery Policy Collaborative, not to contrive something, but to further your own passion space, a policy reform project. And I know the folks that I've invited are passionate about making some serious change that will save lives and promote wellness and freedom. And I'm just completely stoked about what's going to come out of this for folks when they do this. So I'm very grateful for Shelley and the rest of the crew at the Recovery Policy Collaborative. And I'm excited to see so many faces here and what this means for the future of this movement towards freedom and wellness for folks.
This is Patrick Riley in Milwaukee. I would just reiterate what everyone said. I personally, being part of this collaborative has been a huge benefit to me, both personally, I would say more personally than professionally. It definitely helped me work on some imposter syndrome. When they say your ability and access to high level people, they mean it. I mean, your ability to take what you want to do in your local community and then get advice and direction from people that have been doing it for a long time is something that I really took from this. I'm an old punk rocker with a big DIY attitude. And I don't think there's any other space where you can, act locally. I mean, we're all thinking globally, but take what you want to do to your community. And I really think that's where change is going to happen. I know I've got government people on here and friends, but the cavalry is not coming. It's community by community. And my state leadership might take notice of what we're doing here locally in Milwaukee County and then apply that. So I highly recommend that if you have any interest, just at least apply, write up your write up your idea, because that might be the start of something that helps your community. So with that, I pass. Wrong group, but yeah.
Thanks for sharing.
I'm going to be really quick and just add one thing in. Kim Nelson, I'm with SAMHSA, Substance Abuse Mental Health Services Administration, in Kansas City, though. And so I guess what I wanted to add to my, the wonderful words I've heard here is that I believe recovery is evolving, that this is an evolution and revolution, really. But I am so excited, and it has the evolution of recovery and what that means, because I see questions about harm reduction and how we're defining lived experience and stuff in the chat. And I think I'm excited to be part of the evolution. I think that for us, recovery has meant all of those things that are in the chat. And this group has really elevated, I think, that the what's happening, elevated the voice of what's already happening in all of our local places. So excited to be part of it and really encourage you to jump in.
Awesome. Anyone else who's involved in the policy collaborative? I don't know if I see anybody else on. Okay. All right. Man, I see a lot of questions in the chat that I'm going to try to go through. But if folks want to just raise your hand with questions, that might just be easier. I see